Good afternoon, good evening, good night, good morning, depending from where you are watching this video from. Trust we all are doing great. Okay. Today, I'm going to talk about this medical condition called diabetes mellitus. Diabetes mellitus, or DM, as we normally see in some doctor's prescription or in some hospital folders. DM, that is diabetes mellitus. Now, what is diabetes mellitus? Diabetes mellitus is a metabolic disorder that occurs either when the pancreas does not produce enough insulin or when the body cannot effectively use the insulin it produces. Remember, I mentioned this organ known as pancreas. Pancreas is that part of the digestive system that produces insulin. Insulin is a hormone that regulates the blood sugar, blood glucose or blood sugar in your body. Now, this diabetes mellitus is different from diabetes insipidus. Diabetes mellitus has to do with blood sugar glucose or blood sugar in the bloodstream or glucose in the bloodstream. Why diabetes insipidus is a disease that occurs when the kidneys are unable to conserve water. That's another topic of its own. So today, let's talk about diabetes mellitus. What are the types of diabetes mellitus? We have two types. We have the type 1 and type 2. Type 1, in type 1 diabetes mellitus, your pancreas does not produce or make insulin, or it makes it in a little quantity. It is also known as insulin dependent diabetes mellitus, or otherwise known as juvenile diabetes. This one can affect all ages, whether small baby, small child, teenagers and adults. Type 1. Now, in type 2 diabetes mellitus, the pancreas produces lesser insulin in our body, and so the body becomes resistant to insulin, leading to a rise in the level of blood sugar in your bloodstream. So one thing common to this type 1 and type 2, it all got to do with increase in the blood sugar level in your bloodstream. What are the causes of this condition? The exact cause of this type of diabetes is idiopathic, in the sense that the cause is unknown. Nobody knows the cause. It's just it comes on its own. In all cases, whether type 1 or type 2, sugar builds up in the bloodstream. This is because the pancreas does not produce enough insulin that will regulate the body system. You know, the excess carbohydrate, the end product of carbohydrate is sugar. And this sugar, in the presence of insulin, is converted to glycogen, which is in this form glycogen that it is stored in the body cells, whereby it is used by your body to provide energy for normal body function. So the excess carbohydrate we take, its end product is sugar, and this sugar, in the presence of insulin, is converted to glycogen, which is this form, which is stored in the body cells and converted to energy used in the body for its proper function. So what are the risk factors? What are the factors that can predispose you to this condition? It depends on the type of diabetes. Like I told you, we have type 1 and type 2. Sometimes family history may play a part in all the types, both type 1 and type 2. We start with family history. That is when you go to a hospital, the health provider will ask you, either the doctor or the nurse or other people, health providers will ask you a lot of questions. They will ask you your family history, your social history, your surgical history, your medical history. These are the history taking they take. So that is why it is important when you go to a hospital and they ask you any question, my dear, say the truth. Provide them with the accurate information they need from you in any aspect they ask you. This will help them in the management and treatment of your condition properly for you to be well healed from your ill health or your illness. Now, as I said, family history plays an important part whereby they will ask you if there are traces of hypertension in your present generation or in your previous generations. From there, they will give them the idea. And if in family history there's a trace of this diabetes mellitus, they will conduct a test, what we call diabetes immune system cell. And these are autoantibodies. When they extract your blood, when they collect sample of your blood, they will go to the laboratory and test for these autoantibodies. When these autoantibodies are present in your blood, it will give them an insight that you have type 1 diabetes and it is imminent. And not in every case. In every case is that this autoantibodies present in your blood shows that you are diabetic, but it will need further lab investigations. Now, another thing, we talk about race and ethnicity. This also the kind of race you come from it will also lead you to have an increased risk of developing this diabetes mellitus. For instance, the Negroes, like we have the Negroes, there's a race we call the Negroes, that's the black people. You have the Caucasoids, that's the Caucasians or all the Asian people and other Australoids and so on and so forth. You have different type of races, like we the blacks who come from the race known as Negroes. You see that some black people, American people, Indian people, Asian people, and so on and so forth, they have higher risk of this condition known as diabetes mellitus. So it depends on the race, also plays an important role in it. Then we have environmental factors and geographical factors. This equally cause this condition known as diabetes mellitus. Now, what are the signs and symptoms you will see and you think of that this condition is imminent? Now, you have frequent urination. You urinate frequently. You will have excessive thirst. That's the crave to drink, the thirst to take much water, to be drinking water due to you are removing through urination, you are removing water, you are getting dehydrated. You have the urge to drink more water. You also have extreme hunger. Due to this condition, you crave to be eating and eating and eating all the time. You have weakness and fatigue. As somebody that is dehydrating, losing a lot of water through urination, constant urination, you feel weak. You feel weak and you are hungry. So you feel weak and your muscles will become fatigued. You also have blurred vision. You will not be seeing well. Your vision will be cloudy and blurred. You have pins and needles at the extremities of your hands or at your feet, as if they're pinching you with pins and needles. You equally have what you call itchy skin. Your skin will be itchy. It will be itching you. Now you have slow healing of wounds. This is one of the major things that happen to diabetic people. When they have wound, the wound will not heal. The wound will find it difficult to heal. What is the rationale behind this slow wound healing? This is because due to the accumulation of sugar in your bloodstream, the sugar around the area of wound, wound requires oxygen and enough blood supply to heal. There's what you call process of wound healing. It will require oxygen. It will require enough blood supply. But due to this high increase of blood sugar in your blood sugar level, the sugar will accumulate around that area near near the wound, preventing enough oxygen, blood to reach that area. And one, blood carries oxygen. Remember my previous video where I thought about, when I was teaching you about paralysis and the stroke, I mentioned about hemoglobin carrying oxygen reaching to various parts of the body. When there's no enough oxygen, the area will fail, become ischemic, and the place will die, leading to stroke, paralysis, and all that. So when this sugar blocks those areas, the oxygen from the blood will not reach the area. So that area will become gangrenous, what you call gangrene, the death of that tissue or that area. That is when that area dies, it will have no function again. The only thing is to amputate the area. That's why most diabetic patients are being amputated. That means either part of their body is being cut off, either their leg or their hand, depending on where the wound is. That is why it leads to amputation. So what are the tests that is normally carried out to confirm whether this is a diabetes? Like I said in the type 1 diabetes, where I mentioned diabetes immune system cells that contains the autoantibodies. When you notice they will collect your blood sample. They usually do what you call fasting stroke plasma glucose test. That is your fasting blood sugar. You can also do glucose tolerance test. All these, they collect your blood sample and they take it to the laboratory to check the values, whether it is within normal range or not. Now, what are the complications of this condition? Due to the increased sugar level in the blood, this sugar level will prevent a lot of organs in the body from carrying out its function. As a result, these organs will be working more than they are expected to work. And once the sugar overtakes them, these organs will die, will collapse, and lead to a lot of conditions. One, it can lead to heart attack, leading to stroke. It can equally lead to kidney failure, known as nephropathy. It can lead to nerve damages, known as neuropathy. It can lead to loss of vision, blindness, known as retinopathy. So these are the conditions. It can lead to amputation, like I said. All these conditions will lead to these conditions. So what are the preventions? There are no particular prevention that you do a management technique, like maintaining your weight, maintaining a normal weight, avoiding sugary beverages, sugary things, chocolates, sweet, all these sugary drinks, avoid them. Eating a healthy diet, avoiding red meat. Red meat is too dangerous, avoid it. Also, smoking, stop smoking. If you're a chain smoker, stop smoking. Like I said, eat a healthy diet. Now, diabetes mellitus, there are other types of diabetes. You have gestational diabetes. That's the diabetes that occurs when a woman is pregnant. You see her blood sugar level will increase. This is a result of pregnancy hormones, the progesterone, estrogen, progesterone, and so on and so forth. But after delivery, the thing will come to normal. Then we have the neonatal diabetes. That's the diabetes that occur in newly born babies, which will equally go away with time. So these are the conditions, much I will say about this condition for now. Then maybe in my next topic, I will talk about diabetes insipidus. Like what I did today is diabetes mellitus. So my dear, when you notice all these signs and symptoms, make sure you seek medical intervention, not spiritual intervention. Once you are 40 years, I keep repeating, once you are up to 40 years and above, make sure you go and do routine checks of your body. Routinely, maybe every 6 months or every year, you meet your family doctor, check your blood pressure, check your blood sugar level. If you don't know what to do, always check your BP, always check your blood sugar level. Because if you check these two things are the things that normally complicate to other conditions. Health is wealth. Is somebody that is healthy that will go to work, somebody that is healthy will go to school, somebody that is healthy will indulge in businesses. So my dear, take care of your health, stay safe and be healthy. Health is health. Health is wealth. Once beaten, twice shy. As you make your bed, so you lie on it. Make sure you take good care of your health and stay safe and be healthy. I love you all. Follow me on this page for more. Bye.